gonna put the timer now.
The first history station is the back pain.
Yeah.
Okay.
Okay.
So the scenario is a middle-aged man with the back pain. You have 6 minutes to take history and 3 minutes for discussion. Okay.
Okay.
Ali,
Yes,
I will be the patient. Then please put the timer for 6 minutes.
I did start now.
Okay, start here.
Okay. Hello. I'm Dr. Hayat Abdullah, one of the surgical team. May I confirm your name and age, please?
Hello, doctor. My name is Jack. I'm 45 years old.
Can you repeat your name, please?
My name is Jack. I am 45 years old.
Okay. Nice to meet you, Jack. So, how can I help you today, Mr. Jack?
Oh, doctor, I'm really suffering from back pain.
Oh, I'm really sorry to hear that. Uh, would you like to take some analgesic?
Yeah, that would be fine.
Okay, I will prescribe some and I will make sure that the nurse will give it to you. Is that okay with
Thank you.
you?
Yeah, thank you so much, doctor.
Okay, are you capable to carry on this conversation?
Yeah, yeah.
Okay, okay. Nice to know. So, can you tell me more about this pain? Like, where exactly in your back?
Yeah, doctor, it is here in lower back of my back. It started 1 month ago and has been getting worse recently.
Okay, so the first start of the pain is 1 month.
Yes,
Okay. Did it start suddenly before 1 month or gradually throughout the months?
gradually, doctor.
Gradual, okay. Can you describe this pain for me? Like, is it dull? Is it crushing? Is it stabbing? How it looks like?
It is a dull pain, doctor.
Okay. Does it move anywhere else,
No, no,
or
no,
it's
no,
just in the back?
no, just in
Okay.
my lower back.
Okay. So, did you observe that there is a specific time during the day that the pain is more or less?
There is no specific time, but I feel pain when I walk, doctor.
Okay, when you walk. So the walk make the pain worse.
Yes.
So is rest making it better or anything else make it better?
Yes, yes.
Okay. Can you tell me more about how much severe is this pain if I gave you a scale from 0 to 10, with 0 being the lowest and 10 the highest?
It's about 7.
7. Okay, sorry to hear that. Uh, did this pain affect your life in any way?
Yeah, I can't climbing stairs, doctor, and I can't walk for a long distance.
Okay, sorry to hear that. I will make sure to help you as much as possible.
Mm-hmm.
Um, I would like to ask you more few questions if you don't mind.
Yeah, doctor, feel free to ask.
Okay, did you observe any lower limb weakness or numbness?
No,
Did you observe any numbness, sorry for the question, around your anus or genitalia?
no, I didn't experience that.
Okay, did you experience any problem with bowel work or water work?
No, no, doctor.
Okay, so did you experience any erectile dysfunction?
No.
Okay, good to hear that. Do you have any problems with climbing stairs?
Yeah, I mentioned previously, doctor.
Okay, sorry for that. Uh, did you had any trauma to your back
Y-
recently?
Yes, I have trauma about 2 months. But doctor, I would like to mention that I have a surgery 2 years ago.
Okay.
My,
Do you remember what kind of surgery?
it's appendectomy, I think.
Okay, so did you had any surgery to your back?
No, no.
Okay, can you describe that trauma you mentioned?
You know, doctor, I am heavy lifting. Okay, so
Okay,
I think this is my back pain due to it.
Okay. Sorry to hear that. Um, what do you expect from us to offer you or to do for you?
Just figure out this cause of pain, doctor, and treat me.
Okay, we will do our best. What is the most concerning thing for you?
This pain just
Okay. So do you experience any stiffness in the morning?
no.
Okay. Did you observe any weight loss that is not intentional?
No,
Okay. Any fever or night sweat?
no, I didn't experience any of this.
Okay. Do you suffer from any long-term diseases?
No,
Okay. Apart from appendectomy, you didn't underwent any other operation.
no, doctor. Just this happened, doctor, 2 years ago.
Okay. Do you take any medications currently?
I take some over-the-counter medication for this back pain. I
Okay.
think paracetamol.
Okay. And nothing apart from paracetamol.
No.
Okay.
Time
Do
finished.
you
Time finished. 6 minutes up. Okay,
okay.
doctor. Let me just put the timer for 3 minutes. Can you present your patient, please?
Okay, so I took history from Mr. Jack, 45 years old, heavy lifter, who came complaining of severe lower back pain that started 1 month ago. It started gradually. It's dull in nature, increased by walking and decreased by rest. This was after he experienced a trauma 2 months ago. And apart from over-the-counter paracetamol, he's not on any other medications, no chronic diseases, and no significant medical or surgical history apart from appendectomy. Uh, that's
Okay.
what I.
What's your differential for this case?
So my main differential is functional back pain. I will also consider osteoarthritis, rheumatoid arthritis, spondylosis, spinal canal stenosis, and disc prolapse.
And what is the most serious condition you excluded while you took the history?
The cauda equina or disc cord compression or cauda equina.
Yeah. And how will you approach the management of this, the investigation of this patient?
Okay, after going into thorough uh, history and examination, I will start by simple blood investigation, including full blood count, ESR, CRP, LFT, and then I will do lumbosacral X-ray. And if there is any suspicion of codiquina, I will do an urgent MRI, and then according to the suspicion.
Okay. How will you treat the patient, treatment-wise?
Uh, okay, as our main differential is functional back pain, we will go with conservative management. We will involve social worker, and we advise the patient to do exercises, to take analgesia, and maybe intra-articular steroids if possible. And then if there is any possibility of codequina, we will go to urgent decompression surgery.
Urgent decompression surgery, and which medication you're going to give for cord compression and cord equina?
We will give intra steroids.
Which is dexamethasone.
Okay, yes, excellent.
Yes, okay, good. Time is finished now. Yes, so firstly, that's a good performance, I would say. That's a very good performance. You didn't manage to finish all the history section. Your patient said he's a heavy lifter, and that part of the social history. But you didn't ask about the smoking or the alcohol, which is very important, especially smoking and alcohol and stairs.
Yes.
And he voluntarily mentioned both of them for you. He said, "I'm a heavy lifter." That he gave you his job, and he gave you that he's having problems with the stairs. But usually, your patient on the exam date could be very fluent in English, or could be not. He doesn't know how to speak. If you're taking the exam in UK, it's gonna be a very fluent patient. He's gonna be more fluent than you. But if you're taking the exam in Dubai, Abu Dhabi, Oman, Egypt, your patient may be very unfluent, and that will give you a trouble. You have to be very quick in answering the next questions. When you introduce yourself the right way, you said, "Hello, my name, I'm one of the surgical doctors working here." It's better to say to your patient, "Do you want painkillers instead of analgesic?" Painkiller is more layman word. Do you want any painkillers? Analgesia is not wrong, but just painkiller is better. When you're doing Socrates, you say to the patient, "How does it look?" instead of "How does it feel?" You should say, "How does it feel?" or "Is it sharp, consistent?" Not "How does it look?"
Okay.
The walking, not the walk, make it worse. When you ask him, you said, "Does the walk make you worse?" Which could be fine. That's not a big problem. You ask 3 or 4 questions around pain around anus. You want to know if he has incontinence or if he has numbness around the anus, because you want to exclude the cauda equina. But pain per se is not indicated to ask for. If he has a cauda equina, he will feel numbness, or he may be not able to control. He will have stool incontinence or fecal incontinence, but pain is not indicated.
Okay.
Yes. You asked about he experienced trauma. On your presentation, you said he has a trauma, but you said it very late on your presentation. You should say, "I took a history from Mr. John, 45-year-old, who had trauma 2 months ago. He presented with back pain, da 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 da." You should mention it earlier. That's a very strong positive. As we said, you mentioned the strong positive first, and then the strong negative, or important positives, then important negatives. But overall, I would say that's a pass. That's not a fail. You just need to be quicker, faster in asking the questions. Not freaking your patient with don't focus on one question. If your patient is having a difficulty answering a question, just move to the next question. You should remove from your performance. We're gonna upload this clip obviously later on. You can review yourself and see what did you do wrong. That's from my part. I will leave it to Muhammad now. But overall, that's a very excellent performance.
Thank you so much.
Excellent performance, Hayat. I just have 3 points to mention. I think Ali mentioned all points in my mind. First thing, the positive, which I am glad that you exclude cauda equina syndrome before mechanical back pain, because it is an emergency, as we said previously in the last session. And the negative one, I think you missed Pott's disease. So
Yes.
just ask
Muhammad,
about
she didn't miss it. She asked about fever, she asked about night sweat, and she asked about weight loss. I was thinking she missed it, but when I rethink, when I process the thinking, I think but she didn't ask in an organized way. She separated the question. I think.
Yes, yeah. I think fever, she asked to exclude morning stiffness to exclude spondylitis. But specifically for both disease, she should ask about the cough to let the examiner know that he exclude the Bot's disease.
Yes, I agree. Yes, you should make it very clear to your examiner that you know about bots.
Yeah, and the last point about the management of the mechanical back pain, I think you mentioned intra-articular steroid. So in this case, just analgesia and physiotherapy best than intra-articular steroid. Intra-articular steroid for patient with osteoarthritis. Okay.
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 Okay,
Thank you
got
for
the point.
participating.
Thank you so much.
Okay.
Don't forget to watch the video that we're gonna upload later on, so you can reevaluate yourself. And as I said, always practice and record yourself practicing. Okay. Next station, Muhammad. Somebody raised his hand
Muhammad
earlier.
iPhone, could you please,
Okay, hello.
Muhammad, unmute yourself? Hello.
Hello, is my voice clear?
So, Muhammad, your station will be knee pain, okay?
Okay.
So, are you ready?
I will be
Yes,
his
I'm ready.
patient, Muhammad. I will be his patient. If
So,
you
let me
can put
put
the timer.
6 minutes, okay?
Okay.
Okay, start, please.
Okay. Hello, good morning. My name is Muhammad Hassan, one of the surgical doctor. May I confirm your name and age, please?
Hi, my name is Adam. I'm 56-year-old.
Okay, nice to meet you, Mr. Adam. Today I'm gonna ask you a few questions regarding your condition. Is that okay with you?
Yeah, that's fine, doctor.
Do you mind, Mr. Adam, if I take some points in this paper? This will be totally confidential.
Yeah, that's fine.
Okay, Mr. Adam. How can I help you today?
I have this severe pain, doctor, on my right knee.
Oh, I'm so sorry for hearing that. Do you need any painkiller right now?
Yes, please. I would appreciate that.
So I will tell the sister to prepare a painkiller for you. Can we proceed this session?
Yes, yes.
Okay. Can you please tell me more about this pain, Mr. Adam?
I noticed this pain 1 month ago. It was gradual, and it wasn't too bad at the first, but it has been getting worse recently.
Okay. Okay. So, Mr. Adam, is there anything make this pain increase?
I think walking for long distance. I'm not sure, to be honest, doctor.
On the other hand, is there anything make it decrease?
Yes, when I take painkillers and rest, that feels better.
Okay, good. So, Mr. Adam, does this pain is continuous all the day, or it's increase in some specific time of the day?
It does increase after I walk for a long periods. Yeah.
Yeah. So please, Mr. Adam, could you could you point for the site of the pain?
Yeah, it's here, doctor. It's hard to explain, but I think it's inside the knee joint.
Okay, okay. So does this pain go anyway?
No, it doesn't.
So can you please describe me the nature of this pain? How can you feel it?
Sorry, what did you say?
Can you please tell me how you can feel this pain?
It's a sharp pain, like a knife stabbing pain.
Okay. How badly this pain affect your day-to-day life?
Um, I would say very badly. I would say I couldn't walk for long periods, and this is giving me. I couldn't go to social events, and I'm embarrassed because I have this severe pain.
Oh, I'm so sorry for hearing that. I really understand that is frustrating you. So, please, Mr. Adam, can you please rate this pain from 0 to 10, as 10 is the most worst pain you feel? How can you rate this pain?
I would say it goes from 5 to 9. So it will start as 5, and if I continue to walk, it would reach 9 or 10.
I'm sorry for that. So, please, Mr. Adam, do you have any trauma recently to your knee?
No.
Do you does your knee go away while you're walking?
Sorry? Can you raise your voice, doctor, please?
Does your knee go away while you are walking?
No, I don't feel. Yeah, it doesn't.
Does you feel any lock for your knee while you're walking?
No, there's no locking.
Do you have any fever?
No.
Do you have any unintentional weight loss recently?
No. What did you
Do
say,
you
doctor?
have
Sorry.
do you have unintentional weight loss recently?
No, I don't. I don't have any intentional weight loss. No.
Do you have any other joint pain?
No, just this knee, doctor.
Do you have any trauma?
No, I don't have trauma. No.
Okay. Um, does this pain happen to you before?
Yeah, it does. As I said, it does come and goes, doctor.
Okay. Do you ha do you have any surgery before?
No.
Do you have any
No.
medical Do you have any medical condition?
Yes, I have diabetes and I have hypertension.
Okay. What about diabetes? Is it in control? Do you take any drugs for it?
Yes, yeah, both of them under control. Yes, I take metformin and lisinopril.
Okay. Does this problem happen to one of your family?
Yes, my dad has osteoarthritis and he ended up with total knee replacement because of it.
Yeah. Okay. I'm sorry for hearing that. Do you have any allergy for any drugs?
Oh, no, I don't have any allergies. No.
Do you take any regular medication rather than for diabetes and hypertension?
No.
What is your concern about this, Mr. Adam?
To be honest, the pain. I want to get rid of the pain, doctor.
We will try our best to treat this problem.
Ahmed bin, please mute yourself.
Do you have any?
Time
What's
finish.
your hope for
Time
about this?
finish. Now,
Okay.
could you
Yeah,
please
Muhammad.
present your case?
Okay, I take a history from Mr. Adam, 53 years old. I have knee pain for 1 month.
Mm-hmm.
It's gradual in onset and get worsening.
Mm-hmm.
Increased by walking.
Mm-hmm.
And he has a positive family of osteoarthritis.
Okay, so what is your first differential diagnosis?
So my first differential will be osteoarthritis.
Okay, and what the other differential diagnosis?
I should consider the
Mm-hmm.
I don't
Other than osteoarthritis. Do you want me to skip this question?
yeah.
Okay. What's your investigation for this patient?
I will start by general investigation by taking a CBC and also take inflammatory marker like CRP, and I should take an X-ray
Mm-hmm.
for the knee.
What else regarding to your diagnosis? So, okay, how you will treat this patient?
Treated by steroid, corticosteroid.
Mm-hmm. Do you like to mention anything rather than steroid?
Non-steroidal anti-inflammatory drug.
Mm-hmm. What else?
And decrease the weight
Mm-hmm.
and physiotherapy.
Okay. Will he be able to play football in 9 months?
If he needs a surgical intervention or what?
Your patient is having osteoarthritis. Will he be able to play football in 9 months? After surgery, yes.
After surgery? No.
Okay. Time up.
Yes, time up. Okay, Muhammad Ben,
Yeah.
were you driving during the session?
No.
No. All right. Firstly, let's start with the positive. You started your session in a good way. Hello, my name is Muhammad. I'm one of the surgical doctor working here. That's fine. You offered painkillers for your patient, which is a very positive point. You exclude most or all of the differential diagnosis in a very good way. Like you looked experienced doing that, like a clinician who knows what he's doing. That's the positive point. Negative point, when you asked about you were a bit unorganized when you use Socrates. You asked about the nature of the pain later on after you start the differential, and you should just ask what the nature of the pain is. It stabbing? I think you asked twice or three times, and you were not very fluent doing that. You mentioned your patient name multiple times, Mr. Adam, Mr. Adam, Mr. Adam, which is a very good point. Most of the candidate will forget about this, and this will make them lose the 4 mark of the professionalism. You asked about trauma twice. You didn't have a time to finish the social history, which is very important, especially the stairs for such a patient. And alcohol, smoking, all of these are important. The social history is important. You touch on eyes, but if you were efficient at the start, you will find a time to even finish the systemic review. So I think what you need to do to improve it, even though the presentation is very good, you need to train but I noticed on the presentation part, Muhammad, I think you are practicing, but you don't practice to present. Am I correct?
Yeah. Yes. Right.
Yes, you practice. It's obvious you practice, but you finish your practice by just taking the history. You don't present, and you don't allow the other person to ask you the question. Your performance on the discussion part was so less and worse than your presentation on the history, which is very obvious. Very obvious. I will give you A in performing in the history, and I will give you D in performing in the discussion, because you didn't train yourself to present. So whenever you are practicing, make sure if you practice with someone, you reach the point of discussion, you present, and think about it. Your history is between you and your patient. The moment you speak to your examiner is when he asks you to present your patient, right?
Yeah.
So all the impression from the examiner comes from this 3 minutes. And this exam, as we said multiple times before, is a subjective exam. It's not an objective. How your examiner feels about you does matter. And it can determine if you're going to pass or fail. Because if the examiner feels you didn't perform well, he wouldn't give you high marks. So present your case and practice while you are presenting. Don't finish your history with just asking the last question. No. Put a timer for 3 minutes. Let the other person who you are practicing with ask you to present your patient from A to Z. What's your investigation? What's your differential diagnosis? How are you going to treat this patient? Yes. Muhammad gave you a trick to skip a question. And your examiner may be kind to tell you can skip the question, but you should know it. If you struggled in any question in the history or the examination or the knowledge, just say to the examiner, don't say I don't know, because that means you will get 0. Say, can I come to this question later? Can I come to this question later? And if you have time at the end you will say to examiner, did I skip any question? I skipped multiple questions. Can we get back to them? Or can we use this time to answer the question I didn't answer? Don't say I don't know. Say, can we skip this question? You have to use this on your advantage. I think that's all my points. I will leave it for Muhammad. You need more practice. Join us for the next days, and practice the the presentation part.
Very nice, Ahmed. I think Ali go through all points, but just I would like to mention that you have 6 minutes for history session, Ahmed. You should not repeat the question. You ask about the permission twice, and when you ask the patient about the nature of the pain, don't let the stimulator or the patient ask you, what do you mean? Say, could you please describe the pain? Is it dull, stabbing? Immediately explain to patient to let him choose which the nature of the pain he's suffering. And you missed one of the differential diagnosis with the septic ulceritis, right? Did you ask about the septic ulceritis? Any discharge or swelling or redness? I think you miss it.
Yeah.
Otherwise, regarding the management, when I asked you how to investigate this patient, please say first thing, I will do full clinical examination. Then go through the investigation, like signposting, imaging, like knee X-ray, anterior, posterior, and lateral, MRI, blood test. Put the signposting first, and then say the investigations. In the treatment, I think you start immediately by intra-articular steroid injection. You are right, but if you said analgesia, heat application, weight management, physiotherapy first, you will take the mark of the professionalism, which is the 4 mark. Okay?
Yeah.
Otherwise, you did very well. Thank you for participating, Ahmed.
Thank you very much.
Muhammad, the time is I think we just have 2 or 3 minutes. Let's end the meeting and start the second meeting.
So let
We're gonna
us
advertise.
do the
We're gonna
first, the
advertise.
one who before we close the meeting.
Yes. Who's taking the next station? Raise your hand.
Wala,
Please.
I think Ahmed bin Muhammad iPhone. Who's Ahmed?
Okay. Let's start with Wala and then Ahmed.
No,
the next station.
Wala did the first station, Ali. No.
Today.
No.
No.
Okay.
So
That's
Wala, you are next. We're gonna start the meeting, but I think we need like 3 or 4 minutes to start the next meeting. We're gonna advertise in the Medicoplasty. I sent the link here, and I'm gonna send it again. Just make sure you join here. Okay, Muhammad, I need to pray, and we're gonna start in 3 or 4 minutes.
Okay.
You want me to be the patient or?
Yeah, I can be the next, Ali. I will be the patient for this station.
Okay, fine. I'm your patient. Put the time, Muhammad, then.
I will be the patient for this station, Ali.
Okay, fine. I will put the time at that now. Okay, start.
Okay. So, hello, I'm Dr. Wala Abdullah, one of the surgical doctor working here. Could I confirm your name and date of birth, please?
Hello, doctor. My name is Jack. I'm 72 years old.
Okay, it's nice to meet you, Mr. Jack. Mr. Jack, I'm here. I need to ask you a few questions regarding your medical condition. Is that okay?
Yeah, that's fine, doctor.
Okay, so Mr. Jack, how could I help you today?
Oh, doctor, I have difficulty passing urine.
Okay, yeah, I'm really sorry for that. This may be a frustrating condition.
Wala, can you
Mr.
raise your
Jack,
voice? Your voice is not clear, please.
Okay, so, okay. Is that clear now?
Yes. Continue.
Okay. So, Mr. Jack, could you tell me please more about this?
Well, doctor, it started gradually a few months ago and has been bothering me since that time.
Okay. I'm really sorry for that. So, I understand that. Is it getting worse, Mr. Jack?
Yes, but I would like to mention that holding urine worsened it.
Yeah. Okay. So, just Mr. Jack, could you tell me, are you unable to hold your urine at all, or you can pass a little, can pass a little?
I cannot hold my urine for a long time, doctor.
Okay, I see. So, Mr. Jack, could you tell me, do you feel urge to pass urine?
Yeah, that's right, doctor.
Okay, so, and do you notice any increase in frequency that you are going to the bathroom during the day more than usual?
Yes, recently I noted that I go to the loo more than usual, doctor. Could you please help me?
Okay. Okay. So, Mr. Jack, don't worry. We are here, of course, to help you. Just let me continue to know what's exactly going on with you. Okay.
Okay.
Mr. Jack, could you tell me while you urinate, is that take a long time than usual?
Yes, doctor.
Okay.
I
So,
take long time to
after
start my
urination,
urine, doctor. To be more clear, I took more than usual to empty my bladder also.
Okay. I see. So, and do you feel that you're completely emptying your bladder?
No, doctor.
Okay. Do you notice that there is a trickling of urine in your underwear after urination?
Yes.
So, Mr. Jack, could you tell me, please, is there is any change in your color of your urine?
No, I didn't notice that.
Okay. Do you experience any burning sensation while you pass urine?
It's not pain exactly, but I feel discomfort due to this urine retention, doctor.
Okay. So, sorry, I didn't get it. Do you feel are you unable to pass urine recently?
No.
Okay. So, Mr. Jack, could you tell me, please, did you injure your genitalia
No, doctor.
recently?
This is a couple of
Do
questions,
you
doctor.
injure
Why
your
you
back?
ask me?
Yeah, actually, because injuring injuring genitalia that may cause an inability to pass urine or making a disturbance in controlling of urination.
Okay.
Okay, so Mr. Jack, do you experience any tummy pain, lower tummy pain?
No, doctor.
Okay. Do you have any unintentional weight loss recently?
No.
Okay. Do you have any medical condition like this before?
Yeah, I have diabetes and hypertension, doctor.
Okay. Do you take any medication for those?
Yeah, I take metformin and amlodipine, I think.
Okay. Are you in a regular follow-up?
Yeah, all in control.
Okay. So, Mr. Jack, could you tell me, please, do you have any kidney disease before?
No, doctor.
Any similar condition in your family?
No, I didn't. I'm not aware about this, doctor.
Okay. So, I need now to ask you, do you take any drugs rather than those drugs for diabetes and
No,
Time
doctor.
finished.
No.
Time finished. Time finished. Time finished. 6 minutes up. Can you present your patient, please?
Okay, I met today Mr. Jack, who's 75 years old, male, presented with one history of lower urinary tract symptoms. There is no signs or symptoms suggesting an malignancy, as the patient does not have any weight loss. So
What's your
I would
differential
like to
diagnosis?
complete my my differential based on cystatic uptake is an benign prostatic hyperplasia.
Yeah.
But I will also consider that this may be any other prostate pathology like cancer. Also, one stone should be considered, either renal, bladder, or ureteric stone, and also it may be an neurological cause.
Yeah. Urological cause, you said. Like what?
Yeah, like an overactive bladder.
Or urethral restriction. Okay. How will you investigate your patient?
Okay. I'm going to examine complete my history by asking about the social history, as it's an important. Also going to examine this patient, and I'm going to request an investigation.
Raise your voice,
Simple
please.
bedside test. Okay. I'm going to request a bedside test, a simple DB stick. I'm going to arrange an quantitative urinary bladder scan to assess the urine amount in the bladder. Then I'm going to request an full blood count, urea electrolyte, liver function test, renal function test should be assessed also. And also I'm going to request an also an transurethral ultrasound. And I need to
Transurethral.
perform a digital
No, wait.
examination.
Transurethral ultrasound.
Transrectal ultrasound.
Okay.
Before that, I should perform an digital rectal examination also to assess the prostate.
Okay. What's the cause of increased PCA that you are aware of? What are the causes of increased PCA?
Okay, that may be due to an increasing in age in a simple way. Also, prostate pathology like prostatitis, benign prostatic hyperplasia, and prostate cancer. Also, any urological surgery or investigation. And
Okay, that should be enough.
yeah.
How will you treat this patient?
Okay.
Time up,
This
but
the
continue
patient
your
the
answer.
management will be according to patient or to severity of enlarged prostate. We have the choice will be either on a medical management by giving an alpha reductase inhibitor and alpha blocker, or we can do an surgical. We can do an transurethral resection of prostate.
Okay. All right. All right. Good presentation. You did present yourself in a good way. You asked about most of the differential diagnoses. You spent a lot of time in the question that you should already like remember from the heart and just ask quickly, especially the urgency urinary. Sorry?
Yeah, I just get confused if it is an inability to hold his urine or it is an urine retention. So that's
Yeah, so in this case, when you are confused, just okay, on the exam date, go with the most common presentation, benign prostatic hyperplasia, probably going to be your station, not the urinary incontinence. And even though if it's urinary incontinence, you can just exclude the benign prostatic hyperplasia quickly. And do you have any? You don't say medical terms like urgency, which you didn't do, but you spent like 3 minutes in the prostatic symptoms between brackets. So you should just remember them. Are you able to hold urine? Any dribbling? Do you wake up overnight? Like you should remember them quickly and finish them within 40 seconds. You shouldn't spend a lot of time with them. That's why you was not able to reach the social history or the eyes or the systemic review. You should follow. yeah, to improve your confidence and to appear as a confident for your examiner. Finishing your history will always makes you looks better. You also, Wala, you have a lot of and so. You say a lot of and so. You should get rid of this habit. Stop the as. Stop like You have to stop this one, and you have to watch this
Okay.
record. I think you said it multiple times, and the only way for you to know the significance of this and so is by viewing this. I'm saying it too, by the way. I'm still suffering with it, but we have to get rid of it.
Yeah.
It doesn't look professional. The
Okay.
and so, and so, and so. Um, so we said cooking. Quickly finish the prostate question. Remember them by heart. Don't duplicate them. Don't spend a lot of time. You should start with open question. That will save you a lot of time. Like, okay, tell me more about this symptom. Okay, doctor, I have pain. I wake up overnight. I have dribbling. I feel I cannot control my urine. He already answered like 5 or 6 questions by just asking an open question. So especially in this benign prostatic hyperplasia, open question is very important. Start with the open question. Okay?
Okay.
Tell me more about it. That's all
Okay.
what you need to say. I think that's most of my points. I will leave it for Muhammad.
I just have 2 points. First, excellent performance, Wala. Just I think you missed the UTI. We didn't ask about the
Yeah.
females, right? Which is important because this patient has a frequency. Also, regarding the treatment of the patient of BBI, I said that previously, but I will repeat it. You should divide your answer. We have lifestyle modification. I know that you missed the social history because of the time, but lifestyle modification is very important here. Avoid alcohol and caffeine, stop smoking, and limit fluid before bed. And the other thing, medication, then alpha blocker, beta blocker. And then the last thing is the surgery. There is a question, Ali, I think Ali missed it, which alpha blocker had antihypertensive properties? Could you please answer this question?
Okay. Alpha blocker. Okay. Alpha
Has-
blocker is an
Has antihypertensive properties. Give me example.
alpha blocker have anti. Okay, like examples for the
The
alpha
medication.
blocker drug
Yeah, yes.
for the medication.
Yeah.
Actually, I don't know. Is it cancellations?
Okay.
Muhammad, give her the answer.
Doxazocine and tirazosin.
Okay. Yeah.
Okay. Thank you.
That's a very
Okay.
that's a very important question. Yes. Okay. Should we move to the next, Muhammad? Someone said, "Can I ask question?" Yes, you can ask. Just drop it in the comment, and then we'll get to it.
Yeah. Okay. The last station in the history is hematuria.
Who's taking Haematuria? Very important station. Just raise your hand. As you can notice, we don't judge anyone. Everyone can practice. The point is you need. Sorry?
Ahmed bin.
Yes.
He will take this session. Okay. So Ali, I think you will be the patient, right?
Just 1 second, Muhammad. Ahmed bin, I really appreciate you are very ambitious, but because Ahmed bin practiced earlier. So,
No. The practice earlier is Muhammad iPhone, Ali. Ahmed didn't practice.
Oh, okay, fine. Okay. Let's start.
So I will put 6 minutes for you, Ali and Ahmed.
Okay.
Is it Haematuria?
Yeah, hematuria.
Just give me 1 second, Muhammad. 1 minute.
You will not master history, session, and communication skills until you practice. Okay? So we advise everyone to practice this history, session, and communication skills.
Just 1 second.
Hematuria.
Did you put the timer?
I'm ready to put the timer.
Yes, put the timer. I'm ready.
Okay, 6 minutes started.
Hi, I'm Dr. Ahmed. I'm one of the surgical doctors here. May I confirm your name and age, please?
Hi, doctor. My name is Sam, and I'm 73-year-old.
Nice to meet you, Mr. Sam. I'm gonna ask you some questions regarding your medical condition.
Yeah.
Are you okay with that?
Yes, that's fine. Yeah.
Okay. Okay. Sam, what seems to be a problem for today?
I noticed blood coming out of my urine, doctor, which is very unusual, to be honest.
Oh, I'm really sorry about that. Sam, can you tell me more about this problem?
Yes, it started yesterday around 8 p.m. There was some urine coming out. I thought that's fine. It's gonna go away and it's gonna be fine. But it was a red blood and it was huge amount. And I had it the next time around 11 p.m. So 3 hours later on. I was very concerned, and then I came immediately to the A&E around 8 a.m. And as you know, your waiting list is very long. That's why you're seeing me now around 4 a.m.
Okay. Okay, Mr. Sam, can you tell me, is it dark in color or bright?
I already told you, doctor, it's red.
Okay. Can you tell me how has your health been recently? Are you feeling tiredness or
I feel all right, to be honest. Just beside this this urine, I have no other issue. I have diabetes and hypertension, but they are well controlled.
Are you noticed recently any losing in weight or someone of your family noticing you?
No, I didn't lose any weight, no.
Do you have any fever or night sweats?
No.
Okay. Do you have any rush to the loo? How often do you go to the bathroom?
I because of the diabetes, I wake up like 5 or 6 times overnight. But I used to not, like, there was no blood. This blood is recent. And yeah, I have rushing to the loo, but this has been a problem for me for a long period. And I also have, I forgot to mention prostate. They call it prostate enlargement, but it's not a cancer, doctor, luckily.
When you go to the bathroom, do you have to wait or strain until urine start coming?
Yes, I have all the prostate issues, doctor. The urine doesn't come out immediately. It's very weak, and then it's dripping from time to time. Yes, but I take medication for that. But my concern is this blood. To be honest, I'm not concerned about the prostate problem.
Okay. Do you have any back pain?
Yes, from time to time I have some back pain here.
Okay. Do you have any history of trauma recently?
No, no history of trauma, no.
You don't have. Okay. Are you medically fit and well?
Sorry?
Are you medically fit and well without
Yeah, just
hypertension
yeah,
or diabetes?
just the
You don't have
hypertension.
any bleeding disorder or something like that?
No, I don't have any bleeding disorder, no.
Are you taking any regular medication?
No, I don't
Like
take.
blood thinners or
No, I don't take blood thinner, no.
have you had any surgeries in the past?
I had multiple surgeries, total knee replacement that was done
No,
in.
like instrumentation or something like this.
Sorry?
For your like instrumentation or something like this.
Oh, no. I didn't have any instrumentation to my. Yeah, I didn't have any. No instrumentation to my. You mean in my urethra? No.
Yes. Has anyone of your family been diagnosed with any medical condition before?
Yes, my dad has prostate cancer, and he died because of it.
Oh, I'm really sorry about that. I'm gonna ask you some personal questions. Sorry. Do you smoke, Mr. Sam?
Yes, I do.
Are you smoking tobacco or what?
Tobacco, yeah.
For how long do you smoke?
From like I think I started when I was 25.
How much back do you smoke?
20 bags, 20 cigarettes per day. 20 cigarettes per day, 1 bag a day.
Oh, okay. Do you drink alcohol?
Occasionally over the weekend, nothing much.
Okay. Are you following any regular exercise or are you following any regular diet?
I walk. To be honest, doctor, I'm 73. I just walk around the blocks. That's what I can do with a Zima frame and crutch.
Okay. Okay. What's your job, Mr. Sam?
I'm unemployed, doctor.
You're unemployed. Okay.
Yeah.
What
I'm
do you
not
think
unemployed.
is the
Sorry,
serious?
I'm retired. Yeah.
Could you please
Okay.
present your case?
Thank you. Thank you. Mr. Sam, 73 years old, present with bleeding, present with hematuria for 1 day back. He experienced that before 1 month ago. He has no. He has no any history of trauma. He is not taking any blood thinner. My
From your
differentials will
presentation, what is
be
your main differential diagnosis?
my differential diagnosis will be renal bladder cancer or renal cell carcinoma.
What other differential diagnosis?
Other differential diagnosis, it could be stone from bladder or ureteric stone.
Okay.
Bleeding.
Yeah, that's
disorder
enough.
or
That's enough.
infection.
Okay. How to approach this patient?
I will start to do by simple lab investigation. I will start by full blood count, kidney function test, and try to do urine dipstick for assess the infection or and send it for cytology. And my definitive diagnosis. Sorry. I will try to do cystoscopy and biopsy.
And how you will
Also,
treat this
I
patient?
can do ultrasound and see.
Okay.
What?
Continue. Ultrasound for kidney and urethra and bladder.
Ultrasound. Yes, ultrasound for kidney, urethra, and bladder, and CT scan.
Okay. And how you will treat this patient?
Treatment of this patient depends on the stage and grade of the tumor. There is surgical and non-surgical options. Surgical, we try to do, if we confirmed it's bladder cancer, we will go for trans urethral resection of bladder tumor and installation of chemotherapy.
And the non-surgical?
Non-surgical, we can do chemotherapy, radiotherapy, and also we can use immunotherapy.
Okay, you have 30 seconds, and I think you answer all the question. Ali?
Do you want to add anything, Ahmed?
No.
Fine. Okay.
But when you're studying, you didn't notice how's your performance until you try.
Yeah. Yes, exactly, and that's what we're saying. That's why when I did teach last December, I started with the clinical knowledge before, because it was the clinical skills, because I think this is way more important, and you need time for the practice to solidify in your brain. And it's like driving. You cannot just jump into car and drive on the exam day. Your performance is very good, very organized. You asked at the start open question, which, because I gave you a lot of information to make your job easier. That's why asking open question at the start will give you advantage, because your patient will be able to give you a lot of information that will help you. Don't I was a bit difficult with you, and I noticed you lost some of your stamina. You started very in a good tone, and then you became a bit not depressive, but in a low mode. Sometimes your patient will be very aggressive. Your patient will be, I told you about this before, doctor. Oh my God, it's so annoying. Like, how come you're asking me the same stupid question again? So, especially if you're taking the exam in UK or in Ireland or in English-speaking countries, your patient could be very rude, and they do that in purpose. That's not in the communication alone. That's also in the history. So be mindful of that. Don't lose your stamina because your patient is annoying or rude or very unpleasant. You asked about the bleeding disorder and blood thinner. A bit later, you should ask about it earlier, because that's very important. When you presented your patient with important positive and then important negative, which is a good point too, and you finish your Muhammad asked you about the imaging is very important, especially the CT-KUB. So instead of just saying CT, just say CT-KUB, ultrasound KUB, and make sure you mention this in your answers. If your examiner is urologist, like if you work in urology, or if you know how urology operates, CT-KUB is the investigation to go to after cystoscopy. And so CT-KUB, mention exactly this way, and make sure you reach the imaging. If you are afraid you may lose it, start with the imaging first. Say CT-KUB and ultrasound KUB for a specific diagnosis. Then I will do the general investigation during deep stick blood test, full blood count, urine electrolyte, BSA, PSA, cytology, and biopsy. In your discussion, in your treatment, you should mention, I will discuss it in the MDT, because that's a very complicated situation.
Yes.
I gave you conflict answers. You don't know exactly, is it a bladder cancer? Is it a prostate cancer that's bleeding now? Is it a stone? You don't know exactly what's going on with this patient. So especially for the difficult to diagnose patients, mention, I will discuss this in the MDT meeting. And the MDT meeting usually happens in the morning. All the consultant will be there. We will open the patient notes, investigation, and we will formulate a plan. So it's not like a big meeting. It's just a handover in the morning. So MDT meeting happen for every single patient we admit. So mention that one. And then you have the surgical option, TURBT and radical cystoscopy, and non-surgical option, chemotherapy, radiotherapy, and immunotherapy. And this will depend on your patient situation. Muhammad, I think we have 6 minutes. I'm done. I will leave it for you, and then we create another meeting for the last station, and that's it. We should finish before.
Yeah. Okay.
Yeah.
Nice performance, Ahmed. I think I have 4 points, 2 related to the professionalism. Already Ali mentioned before, which is repeated question. If the patient or simulator saying that you asked me this question previously, just be calm and say, I'm really sorry. I just wanted to confirm that. Okay. Regarding your voice, please show empathy in your answers or your questions. Okay. Also, the knowledgeable point.
Yeah, for showing empathy, Muhammad. I think when I said my dad died of prostate cancer, Ahmed, did you say I'm really sorry for your dad? Did you say that?
Yes. Yes.
Yes.
I don't say I'm really sorry for your dad, but I said I'm really sorry.
Okay, fine. Make sure your tone is matching. And I think one of the points also you did a good, don't say I'm really sorry for your dad. Say, I'm really sorry, Mr. John, for your dad loss. Make it like you are acting. This exam is all acting. Yes, and you mentioned the name multiple times, and that's also a good point, I think. Did you use a paper while I'm taking the questions?
Yes, I used just for a name and age. I couldn't do that.
When is your exam?
In April.
April. Yeah, it's you have one on 3 weeks, 6 weeks. I mean, try to train yourself not to use a paper. Remember the name and remember the age. Okay, Muhammad.
Also, the last 2 points. Also, you missed to ask about the clot, Ahmed. Should ask about it.
Yes.
And if the examiner asks you how to treat or how to investigate this patient, please start by saying, I will do full clinical examination. And in this case, because of bladder cancer, you should say in the treatment, I will discuss the case in multidisciplinary team. Okay?
Okay.
Otherwise, you did very good.
Okay. Thank you.
Thank you
Okay, I
for
think
participating.
we have 6 or 4 minutes for the meeting. That will not be enough for the last station. Let's see who raised his hand earlier. Those who are going to practice for the next. We have Mus'ab Musa and we have Tasabih.
The next station is the
Um,
communication skills, is the counsel's
Commu-
operation, which is the arthroscopy.
Arthroscopy. I'm not sure who raised his hand first, to be honest. We have Mus'ab and we have Tasabih. Tasabih, did you practice
أنا
yesterday?
أنا أنا دكتور
Oh, sorry?
أنا داخلة أنا داخلة بزوم مصعب أماني أنا رفعت أول
Amani.
So,
Muzaf Feris, she said Muzaf Feris. Ali.
Fine. Okay, let's
مصعب
can you
this me أماني
Amani.
مصعب كان
Okay,
Hmm.
Amani, you practiced with us yesterday, I will remember. And Tasabih, did you practice yesterday?
Yeah, I did. I think that's the
Okay, so
priority for I did.
fine. Okay, so we'll go with Amani because you opened first. Let's open a new meeting, Muhammad, and then we will start.
Okay. So just
And,
go inside and communicate with the patient.
and this is not the first cancellation.
This is the second
This is the
call.
second, right?
Yeah.
That's why he's upset. Okay. Okay, start with the timer, Muhammad.
Okay, let me put the timer, please.
9 minutes.
9 minutes started.
Good evening, Mr. Muhammad. I'm Dr. Amani. I'm orthopedic trainee, work covering for my consultant. Nice to meet you.
Doctor, is it my turn now for the operation?
I understand that you are here for your knee operation, but I'm really sorry to inform you that unfortunately your operation is cancelled as my consultant was called for emergency and he cannot be able to carry it out today.
Let me just okay, hold a second. Can you repeat what you just said?
I know that you are here for your knee operation, Mr. Muhammad, but I'm really sorry to inform you that unfortunately my consultant has been called for an emergency case and we cannot carry your operation today. I'm really sorry for that.
Oh, so what should I do with your sorry? Make a soup out of it. You said it last time, and I came here for my operation, and that's, to be honest, that's a negligence. I wouldn't accept that. How come whenever I come here, he went for an emergency? Why there's no consultant who's covering an emergency and you have someone who's covering the elective? I came from Wales. That's 3 hours travel, doctor. That's 3 hours travel. And I canceled my shift. And I informed all my family that I will have my operation today. That's very inconvenient.
I do apologize again, Mr. Muhammad. I know that your knee is troubling you a lot, and I know that how important to carry out this operation today. And I know that from your notes, this is not the first time for your operation to be cancelled. But always the emergencies has the priority. For that, my consultant has been called for an emergency case. Really sorry for that.
Okay, doctor. That's very condescending. And you said the emergencies take priority. I know you consider my situation not an emergency, but it's an emergency for me. Why don't you have another consultant who's covering an emergency?
This is true, but we have only one consultant covering this emergency. We can discuss this issue with the hospital manager later on. I'm really sorry. I do apologize again, Mr. Muhammad.
Okay, can you call him? Can you call him? Because he promised me last time. He gave me a phone call and he said, come next week and we're going to do your operation. And he promised me there will not be any delay. Can you call him now, please?
I'm sorry. I cannot call him because he is busy with that case now inside the operation room. I'm really sorry.
Okay, he's on operation room. Why can't you call him then? I'm sure he can answer.
Yeah, he will not be able to answer because he's busy with that case, and he could be sterilized and not touch the phone. I'm really sorry for that.
Okay, can he do my operation after this emergency he's doing then?
I think this unlikely because he has another cases and has especially rescheduled.
Oh, so there's no way for you to help then, or what you are good at is saying I'm sorry, right?
I'm trying to help, Mr. Muhammad, but as I told you, always the
It doesn't look.
emergency
It does,
cases has the priority.
doctor. It doesn't look like you're trying to help at all. I said call him. You said no. I said okay after the operation. You said no. Okay, do the operation yourself then. Aren't you a doctor?
I said that also I'm really sorry because I'm not
Sorry?
authorized to do such operation.
Are you
I'm
laughing?
really sorry.
Are you laughing, doctor?
No,
Why?
no,
What
no,
did you say?
no,
Sorry.
Mr. Muhammad.
What did you
I'm
say?
really sorry. I'm not authorized to do such operations by myself.
Why
It
you
should
working
be
in the
run by
hospital
my
then?
consultant.
Why are you working in the hospital then?
As I told you earlier, I'm possibly trainee. I cannot do such operation. I'm not authorized to complete my trainee program. I'm really sorry for that.
Okay. I feel like punching the wall. And every single suggestion I suggest, you obstruct. And you seem like you have no solution. Give me another appointment then. Give me another point. Don't say you cannot
I
even help with that
appreciate,
one.
I appreciate
Please
your
don't
worries.
say you cannot help with that one, doctor, please.
Yeah, I appreciate your worries, and I know you are feeling frustrated. I will mention these circumstances, and I will emphasize that to try to listen to you in the next possible session. Are you okay with this?
I didn't get it. What did you say?
I will.
What did you
I
say?
will. I promise you, Mr. Ahmed, I will mention your circumstances and emphasize that the importance of putting you listed you in the next available session.
Okay, but as I said, I came from Wales and I need another appointment now before I
Uh,
leave the hospital.
I'm sorry, I cannot give you the next appointment just now. We will give you. We will contact you when a date will be available. But I will mention your circumstances and emphasize that the importance of giving you appointment in the next possible session. Are you agree with me?
No, I don't. I don't agree with it. Like with a single letter or a single verse you're saying. Okay, so as long as you're that useless, what about you giving me? I have my shift canceled, and I told them I'm coming here for the operation. Will you give me a sick note? I'm a boss man. I work while I'm walking on my feet. Uh,
Yeah,
my job gonna be
definitely.
very
Yeah,
difficult.
yeah, definitely. I will help you. We can help you regarding this. I can contact your employee, can write a letter and explain the medical causes of why you cannot carry out your job as a postman, and your operation was postponed and you need to give you more you need more sick leave. Even if you want me to call him, I can call him for you. No problem.
Okay, at least you're doing something beneficial. Also, my painkiller, doctor, diclofenac, it does give me heartburn. Can you change them for
Mhm.
me?
Yeah, definitely I can change it for you by one more suitable for you. And for now you can stop it because it will end, yeah, will cause this hard pain. I'm really sorry for this.
Yeah, okay, fine. I want to complain on your consultant because he's being unprofessional and he told me to come from Wales and I wasted 7 hours. Uh, and I told everyone in my family that I will have the operation today. I want to complain on him.
Yeah, you have right to complain against anything that you are not agree with it. No problem. This is your right. But as I told you, this is emergency and has the priority and nothing
Yeah,
to
I
do
don't care,
regarding.
doctor. With all due respect, I don't care of what you told me. As I said, I'm not convinced if it's I think my case is an emergency, and if you have an emergency, it should be covered with another consultant. And your consultant was supposed to do my operation, so uh, I want to complain. How can I complain?
No problem. There is a department for complaint. I will give you the information to contact them. Don't worry. It is your right to
What,
complain.
which people you said?
There is a department responsible from this complaint.
What's the name of the department?
It is the patient complaint department.
Okay. Okay, can you tell me how the arthroscopy is done? The one that you canceled
This
today?
is this arthroscopy it is a device containing camera. We are doing small hole through your
Time up.
knee and inserting.
Okay. Muhammad,
Yeah, I think
I,
you put her in a very hard situation, Ali.
which is good for her and good for
Yeah.
everyone. Amani,
Hello.
your examination will not be that difficult, even though during my exam, I had a lady and she was screaming and she was more difficult than what I acted now. So those people who are taking their exam in UK or English-speaking countries, they should expect a very hard situation like the one I put you through. If you're taking your exam in Dubai, Oman, there's low chance you experience such a violent behavior from a patient. Okay, you did very good. You you are consistently calm. You didn't panic. You answered all the question in a right way. The only question that you didn't answer is the department. It should be the PALS department, Patient Advice and Liaison Service. You should remember this. You should memorize this one. Patient Advice and Liaison Service. But your performance is excellent. Is very good. And as I said, don't expect your patient to be domestic. Your patient could be violent and wild. Tell me, how did you feel during the station? I made you anxious, right?
Allah.
Yeah. Imagine yourself on the exam, and I tried not to shout, but some patient will even shout. The lady was shouting at me, and she was raising her voice and her hand. So expect that.
Very hard, very hard.
Yeah, Muhammad.
Yeah, I have no any point to add. Just your answer is very clear, Mani, and you showed empathy in your voice and your tone. And I am very happy that you deal with this difficult situation in a good way. Thank you.
All right, we're done for today. We're gonna upload the session as we used to, review it. If you have any question, drop it in the WhatsApp or in Telegram. Please ask any question.
Someone asked
If you
question,
know,
Ali,
yes,
about the group session. Ali, please put the link in the message
the link of what?
of WhatsApp group and Telegram group.
I added it already.
Yeah.
I added it. It's in the chat. Go up. Let me just put it again.
Hannah Noor, I think, asked about that.
سوري دكتور بس في اسم بس في الاول احنا حابه انه نقول اوبن كويشن. طيب انا لو قلت اوبن كويشن خد يعني مثلا 4 5 في مثلا السيستم البرنامج السيستم بركليتي. طيب انا ما حاضطر اساله لانه حكون ريبيتي. هو حيعمل لي تشيك ليست هيأشر عليها ان انا سالتها ولا كيف الوضع.
Good question. Say it again.
مثلا بس اول نسال اوبن كويشن. انا سالت اوبن كويشن الباشا متطوع وقال لي عنده ايرجنسي هيزيتنسي فور ستريمينج مثلا عنده
ممتاز
كده. طيب
أيوة.
انا ما حقدر اسال كلهم الان حيكون ريبيتي. طيب
أيوة.
بغادر الاكزامينر حيخلي لي التكليف دي فاضي ولا حيأشره ولا كيف وضعك؟
يلا
لا محمد. اوكي I will leave محمد.
يلا يا أماني، أنت ما حتعيدي الأسئلة. ليه؟ لانه اوريدي العيان منشنه وعندك 6 دقائق المفروض تخلصي فيها كل الهزيله. لكن بتثبت للاكزامينر حتى لو كان هو مركز اثناء الستيشن انك انت الهزيله دي اوير انه العيان قالها بالدسكشن بتاعك او بالبرزنتيشن بتاعك. في البرزنتيشن بتاعك لازم تمنشن الحاجات دي عشان تاكد للاكزامينر انك انت اوريدي سمعت العيان قاله. تمام. اما اذا حسيت انه الاكزامينر في اللحظه دي هو كان بعيد جدا عن الستيشن وما مركز تماما، فممكن تعيدي كم سؤال منه على اساس لانه عندك باقي أسئلة المفروض تخلصهم. تمام.
جميل.
So, okay, if the examiner was paying attention, then you don't need to ask, and you just mention it in the presentation. If your examiner was completely blacked out and he doesn't listen, do you raise your voice? Okay, Mr. John, you told me you have dribbling and you have a weak stream, right? Yes. And then you proceed. Don't waste a lot of time on this one, okay? Okay, Muhammad.
We're done for today. Thank you for everyone participating. And the next session after on the 22, I think, are you right?
Yes. I just want to say, for those taking the exam in UK, please drop me a message if you're taking your exam in UK. All right. See you next time.